Meet Reid Lance Rosenthal, rancher, #1 best-selling award-winning author, and unabashedly, unapologetically on the right side of the outstanding issues of our generation. But don't try to fence him in. Sometimes his positions will surprise you, because Reid is definitely his own man, with his own opinions. You might love him, you might hate him, but you won't be able to stop listening. Step over to the right side with Reid.
This is Reid Lance Rosenthal. Happy Saturday, Rocky Mountains, broadcasting to you on the Right Side Radio from KGAB AM 650 and the Town Square Network, serving the Intermountain West. Colorado Springs, Easy 101 FM, serving northern New Mexico and southern Colorado, and Monster 780 AM Denver, serving just about everywhere. And welcome, Rocky Mountains, from Montana to New Mexico and Nebraska to Utah. This is the wrap-up, folks, of our Obamacare series. I hope that you have liked it. It has been a wealth of information. I'm pretty well up on this stuff, and I've learned a bunch myself. If you remember, 3 weeks ago, we had Kimberly Amadeo, an economist, who talked about the economies of scale, or lack thereof, of Obamacare. She was kind of neutral. And then we had Timothy Yost, PhD, yada yada, and health lawyer who, for the Obamacare for the Obama administration, who extolled the virtues of Obamacare. That's quite a spirited conversation. You should listen to it. You'll learn a lot just by our disparity. And then last week, we had a great guest, and her name was Elizabeth Fleet, Dr. Elizabeth Fleet. She has an international deal that she's setting up to help people get offshore services and stay self-reliant, because you're not going to be getting the services that you used to be getting in the United States. And this week, I'm delighted to have, to kind of wrap up this grand slam on Obamacare to get you educated, Grace Marie Turner. And Grace Marie, she has written for so many different papers, the Wall Street Journal, USA Today. She's been on ABC's 2020, hundreds of radio shows, you name it. She received the 2000 Outstanding Achievement Award for Promotion of Consumer-Driven Healthcare from Consumer Health World. She's been the Executive Director of the National Commission on Economic Growth and Tax Reform. She's been the President of Arnett & Company, Health Policy Analysis Communications Firm. You name it, she's done it. And she's written a terrific book, Why Obamacare is Wrong for America. It was published by HarperCollins. You can get it on Amazon, Barnes & Noble, I'm sure through your local bookstore. And there is a chapter on there which I'm specifically going to dwell on, because we're going to talk a little bit about Obamacare, and we're going to talk a little bit about the October 1 date, which is looming. You've kind of heard about it in glimpses and pieces on the news, and some of it's been delayed by the president and yada yada. She's going to bring you up to speed on that so you understand it, and it cuts through all this fog and gibberish, the rest of the story. And we're going to talk a little bit generally about Obamacare, spiritually, financially, why it doesn't work. But more importantly, we're going to spend more than half this show talking about our ideas, particularly Grace Marie's ideas, on how we can fix what is wrong with the healthcare system in the United States, how we can really lower costs, how we can actually enhance the quality of care rather than slice it in half, as the Obamacare deal, if implemented, will do. And so, we're going to end this series on a very positive, proactive note, and it's ideas that you can take to your congressmen, you can take to your senators, and hopefully we can get this beast turned around. So welcome to the show, Grace Marie.
Reid, it's such a pleasure to be with you, and thank you so much for the service to your listeners of really having this in-depth discussion with people from various perspectives on the law to really help people understand what's probably one of the most consequential pieces of legislation in a generation.
Well, absolutely, and Nancy Pelosi doesn't understand it. I think my listeners are better informed.
I think that's probably true.
Yeah, unfortunately, right. It is probably true. Listen, I want to ask you, Grace Marie, let's start off with the big picture. You got this big beast out there. It has many, many tentacles. It has 2,700 pages. Parts of it are buried in TARP, as the audience learned last week with Dr. Fleet, including the iPad, which is a scary, scary rationing board on health care. Give us the 5 things that you see that are fundamentally wrong with this bill.
I think that the main thing, Reid, that really motivates me to focus 24/7 on helping the American people understand this law is the incredible risk to our freedom. If the federal government controls something as crucial as our access to health care, and that's what this law does, then it takes our freedom away to make our own decisions, to use our own resources. The individual mandate, certainly the most unpopular part of this law, basically tells us that we have to use our own private personal resources to purchase a product that the government is mandating that we must purchase. And this is something that for many people, it's a product, health insurance, that can cost more than their mortgage payment or their rent. And so this is, to me, when the federal government starts telling us how we have to spend our own personal money and then gets involved in having access to private, sensitive healthcare records. And, of course, the other side will say, oh, well, they won't know about your particular records. But once they're in a master database, then, as we've seen with all of the NSA, the controversies and the lack of security there, it's only a matter of time until our personal health records show up on the Internet. So I think the privacy, the ability to continue to have the economy be able to function based upon normal supply and demand and market forces. Instead, you have companies from the smallest companies to the largest companies now having to basically distort their hiring practices, even how they pay their employees, in order to comply with a healthcare law. You know, we've seen millions of people around the country losing their jobs, losing their full-time jobs, being put on part-time involuntarily. Employers don't want to do this. Employees don't want part-time jobs. But the law says if you don't provide health insurance to an employer, and your employees work more than 30 hours a week, the new definition of a full-time work week, then you have to pay a fine of $2,000 or $3,000. And I have talked with numerous employers, especially in the service industries, franchise restaurants, for example, that tell me that just paying the fine for not providing health insurance is more than their profit margin. So they're telling me, why should I even open my doors? I will lose money out the get-go. And the other side will argue, well, they can just raise their prices. No, they can't, because people won't go out. They will not spend that money if the prices are too high. So it's distorting the economy throughout. I think it's one of the major reasons that the economy has been stalled, that our unemployment rate is still so much higher than it has been after any recovery from, it certainly was a deep recession, but this recovery, we have not seen the gains in employment, and I think that the major factor is the depressing impact of ObamaCare.
I think there's many factors, but I think that is absolutely one of the key ones. I'll tell you, Grace Marie, that from my standpoint, we have a ranching business and we have a consulting, management, resource business, et cetera, and of course, I'm an author. But several of my employees, I've actually helped them find other positions so that they can work for me part-time, number one. And number two, I've actually let one employee go because, there were ways to kind of fill that gap. I mean, there were other things going on too, but the bottom line is that my decisions, and of course I follow this Health Care Act, unlike many people, my decisions have in fact been based substantially on the penalties and the problems associated with that law for an employer. And I don't care whether you're an employer of one or you're an employer of 10,000. I mean, obviously there's some break points in there. So I happen to agree with you 100%. I'm going to go one step further, too. I talked a little bit about this last week. I'm sure some people rolled their eyes, particularly those liberal listeners of mine who just listen because they love to hate me. The bottom line of all this, if you take this enormous data bank of medical information, you combine it with the political, religious, day-to-day traffic communication, website visits, phone calls that the NSA is collecting, it's not a stretch of the imagination to think that healthcare rationing may be doled out not only on the basis of eugenics and age, but on the basis of political and religious beliefs. I mean, I don't know about everybody else, but I just don't trust Joe Blow at the NSA and Joe Blow at the IPAB collaborating on clandestine emails with my health information, my political affiliations, my religious beliefs, and deciding whether or not I live or die or get a hip replacement. That's just not my idea of a good time.
Well, and remember, Reid, that the IRS has 46 major powers to implement parts of this law, so they already know a lot about us through our tax records.
Absolutely, and we know, Grace Marie, how apolitical they are. Absolutely neutral, down the middle of the road. They never stray left or right. Right. Anyway, it kind of proves my point. What's the second? I happen to agree with you. Risk to freedom and risk to American values and the American way of life as we know.
And then the third thing is the impact on the economy.
Yes. And the impact on the economy.
So fourth, I think that fourth and fifth are the impact on Medicare and Medicaid. So we already know, according to the Congressional Budget Office, that the law is going to take $716 billion out of Medicare in order to create this new, huge, massive new entitlement program for private health insurance. What that means is that doctors and hospitals are going to be paid less and less over time. Seniors are going to have fewer and fewer choices. Many seniors, a quarter of seniors, have voluntarily selected health plans within Medicare, private health plans that provide them more coordinated, more comprehensive health coverage. Those plans are going to struggle, and many of them won't survive. But the Congressional Budget Office and the Chief Medicare Actuary have said that the cuts in Medicare will mean that at least a quarter of the physicians in the hospitals and others serving Medicare patients will either go out of business, go bankrupt, or have to stop seeing Medicare patients because they're losing money on every one of them. So the risk to Medicare is very serious. The president, it's just shocking to me that during the 2012 presidential election, he was talking about how Republicans were going to hurt Medicare with the Ryan plan. The president already, according to his own administration, is taking $716 billion out of the plan over 10 years and cutting payments to the point that Medicare providers go bankrupt. If that's not a direct impact on seniors, I don't know what is. And I also worry, go ahead.
You know what Hitler said in 1934, if you must tell a lie, make it the big lie and tell it often.
Make it a big lie. Yeah, that's right. But the fifth thing that really, really concerns me, and this may be my most important concern, is the impact on the most vulnerable Americans. Look at people on Medicaid today. 50 million Americans are on Medicaid. Many of them are on Medicaid, the joint federal-state program that provides health care coverage to lower-income Americans. This program is already bankrupting state budgets, but these people on this program often have no other choice. They're on Medicaid because that's the only place they can get health coverage. We may be throwing, depending upon what the states do, as many as 20 million more people on to Medicaid. One of the analyses that the Congressional Budget Office did said that they expect as many as 87 million people on Medicaid. Medicaid already pays doctors and hospitals less than their cost of providing care, which is why so few physicians can afford to take more than just several Medicaid patients. The paperwork is enormous, and they get paid so little, so we're going to put many millions more people on a program that is already making it difficult for people to have access to care. That's why so many people on Medicaid go to hospital emergency rooms, because they know that if they wait long enough, they'll get care.
And saddling a system that is already overburdened, 68,000 doctors short, projected by the IRS to be 120,000 doctors short by 2020 with 30 million new patients. 2 plus 2 is 4. Something has to give, and it's going to be the quality of your health care and the timeliness of the services if the services are approved by the IPAB. And that's a big if.
Exactly right. That's
right.
You know,
in fact, you might explain to the folks that even if they have, let's say, Blue Cross, Blue Shield, Cadillac Plan, Humana, Aetna, you name it, when the IPAB gets rolling here in 3 years, if they say no, if your doctor says he wants to do the service, if you have the money to pay for the service, if you have a private insurer still, those that will still be in business, that will fund the procedure, the IPAB can shut you down.
You know, I think the name of the IPAB, the Independent Payment Advisory Board, they started out by calling it the Independent Medicare Payment Advisory Board because they were just going to contain it to Medicare, and that's what they now are saying. But they really do envision, Reid, and I think you're really on the right track. They envision this board of up to 15 unelected representatives who are going to have dictatorial powers over Medicare payment policy. They see that spreading to be able to have dictatorial powers over all healthcare payment policy. And one of the scariest things about this, Reid, is that the default in the legislation, if they don't have all 15 members, because they do have to be approved by the Senate, or they don't have a majority or a quorum, the Secretary of Health and Human Services can make those decisions herself. So you've got a dictator.
Ask that 11-year-old gal that was waiting for a lung transplant how well Kathleen does on that.
Yeah. That's exactly right, and talk about a conflict of interest where she's running health programs and also trying to save the federal government money. I mean, it's just shocking to me the power and control that this law gives to government bureaucrats and government and political appointees over 1/6 of our economy, to be able to make decisions on something as vitally important as our access to health care. Decisions are now going to come from Washington, not from doctors and patients.
And, you know, last week the show kind of centered on what it was going to do, particularly to women. You know, I have to laugh. The Democrats scream about the war on women. This bill was passed entirely and exclusively by Democrats. It's being pushed entirely and exclusively by Democrats. And the reality is that this bill more heavily penalizes women and particularly penalizes older women. I mean, by elimination of screenings, you know, for cervical cancer, mammograms after age 50, I mean, on and on and on down the road. And it all kind of boils down to eugenics. But we talked about that last week, folks. You can listen to that in the archives on the rightsideradio.com. And by the way, while I'm talking about websites, let me give you Grace Marie's, because she has a gangbuster website at galen.org. That's GALEN.org. She's good. She's just coming up with a website, folks. It's going to be kind of the Drudge Report of not medical technology, but medical policy reporting. So you'll be able to, it's one-stop shopping. You'll be able to go and see what these goons are thinking of next. We're going to have that link on the OTR site, so definitely be checking it out, and that link will be up, when do you think, next month or two?
Yes, in September, and it's
right,
going to be called ObamaCareWatch.org, and people will be able to go there. Everything you need to know about what's happening with this law will be in one place. All the best writing, all the best reporting.
Everything you need
to
know.
But we need to know it, Reid, unfortunately.
Oh, absolutely. All right, great. Well, we're going to have that up on the website for folks to be able to follow along, because it's a scary deal. Let's finish up this part of the conversation with talking about the effect not only to the American economy, but the effect to American finance. That is national debt, tax. Bottom line is, we were promised by this president who, when he moves his lips, falsehoods come out. We were promised $940 billion in costs. Then it got expanded. They wanted a little cushy in there, so they got their $715 billion from Medicare. They got their $675 billion in new ObamaCare taxes. Folks, go back in the archives, put in the search bar Obamacare taxes. listen to my show on that. 21 new taxes, $675 billion kicked in January, and $480 billion will fall on people making less than $200,000. Do you remember that promise? If you make less than $200,000, not one dime, not one dime. You remember that? You can Google it right up and watch them say it. The bottom line is that $1.3 trillion, I'm rounding numbers, is now shown by the CBO in their 2012 10-year rather than 9-year projection to be another $1.3 trillion short of implementing this law. In the year 2022, they are projecting $265 billion a year annualized cost, which by my calculator, multiplied by 10, comes to $2.7 trillion. And by my calculator, if you subtract the $1.3 trillion they have managed to steal from us so far, leaves us $1.4 trillion short. Grace Marie, where are they going to get that money?
They're going to borrow more money from our grandchildren. This is one of the things that absolutely astonishes me, Reid, is that they are trying to get young people to sign up for this coverage. First of all, young people are going to have to pay disproportionately more for the insurance coverage, so older people can pay less. But they're also going to be saddled, you're absolutely right, with huge, enormous debt because this law is not paid for. Remember, they forward-loaded it. They started collecting taxes right away. So they had 10 years of taxes and only 6 years of spending in this first bill.
And they're
saying, okay, we're buying a house and we're not paying the mortgage for the first 4 years.
Right, and they're still
not going to work out.
And they're still $1.4 trillion underwater.
And that's only the beginning, Reid. This is going to blow the roof off of federal spending.
And not only going to blow the roof off federal spending, but as I keep reminding my audience, there is, in the end, folks, there is only two sources for the government to fund its nonsense: your pocket and your property. There is no other source, folks. There is no other source. So that $1.4 trillion, maybe we'll gloss it over by borrowing it from China for a while, but in the end, you or your kids, and ironically, as Grace Marie was saying, the younger folks who are being extorted and extolled to join this monstrosity are going to wind up paying for it. So, you know, when they say, I believe the ObamaCare proponents say, well, it's going to save $104 billion in deficit over 10 years. I'm sure you've heard that, right, Grace Marie?
Right.
Well, let's see, folks. Let's do the math on this. If you have a bill that costs $2.7 trillion, you're raising it all by cutting Medicare and raising taxes. Who is paying the $2.7 trillion? We are. Who are we? We're the government. Did we save $104 billion? Or did we spend $2.6 trillion? You guys figure it out. I know the answer. We're $2.6 trillion in the hole, and that's if they meet their goal of $104 billion. And $2.6 trillion, Grace Marie, wouldn't you agree, is going to have a stifling effect on the American economy? $2.6 trillion out of private pockets into the government's pockets?
Oh, well, they think, though, Reid, that this is jobs creation. We're going to create all these new jobs. Well, then why don't we have everybody work for the federal government? We'll just have the government create all the jobs in the country. And
absolutely.
Then who's going to pay the taxes? That's what they think, though.
Under Agenda 21, we can live in our little 800-square-foot cubicles and bicycle from our inner-city neighborhood to our government job, and everything will be just hunky-dory. Dynamite. I love it. I can't wait.
Crazy.
I can't wait.
Somebody's got to be working and producing for our economy to be able to produce the revenue so that it can fund the government. I don't know where I think they just think the money comes out of thin air. I don't know what they think.
No, they know where it comes from. It comes from everybody else's. It's OPM, other people's money.
Yeah.
They use other people's money.
That wonderful Margaret Thatcher quote says the problem with socialism is eventually you run out of other people's money.
That's exactly right. And that's exactly what we're going to be facing here, along with a number of other things. Why do you think the people who are so hell-bent on passing this bill and now implementing it, despite the fact of some of the problems and delays, which we're going to talk about next, what is really motivating them?
Well, you can't know other people's motivations, but you do listen to what they've said. And the president said before he was running for president, when he was running for the Senate, he said if he really had his way, he would want the government to be fully in charge of the health sector. Senator Harry Reid, the majority leader in the United States Senate, said just a couple of weeks ago that, of course, all of this is moving us toward a single-payer system. And I have talked with any number of people who are strong supporters of this law. They just can't stand that there are any private physicians, private hospitals, private provision of care anywhere. They think it all ought to be controlled by the government so that they can write all of the rules and tell us what care we can have access to, what physicians are going to be paid, and that's one of the reasons the IPAB is so important, because then you've got somebody outside the political process to make decisions that can ultimately result in rationing of care. So I do believe that they see this as part of their march toward government control over our health sector.
Mm-hmm. Well, government control of everything. Would it be fair to say you've been in this business for decades? You've been focused on Obamacare since before it was an act. You've written your books, etc. Would it be fair to say that to many, there are some out there who really do believe it's wonderful and people are going to be covered and, they're in the kumbaya land, but that's fine. I understand that. But let's talk about the people at the top echelon, the Harry Reids, the Nancy Pelosi's, the Barack Obamas, his czars, etc., Catherine Sebelius, the rest of the crew. Is this really about people's health care and well-being, or is this really about government control, government income, and the expansion of government into every sector of our life? I mean, which is it? They care about it, or they care about government?
When you look at the record, Reid, there is every evidence that they believe that if the government controls health care, they would never trust conservatives or Republicans to run the health care system. So I believe it's about political power. And there's actually a wonderful quote from a book called The Social Transformation of American Medicine by a person who's been a big advisor to both Hillary Clinton as well as President Obama, and he says this. He says, politicians since Bismarck have learned they could use insurance against the cost of sickness as a means of turning benevolence into political power. So I think that's really what it's about. It's about political power, and I think that's why the president just went for broke with this legislation. And they're shocked. They're really surprised that people aren't in love with this law. They're thinking, we've given you all these free things. We've given women free birth control. We're giving you all this free stuff. Why don't you love us? Why don't you love this law?
Right.
And I think they don't know this country.
Here's your free birth control, but sorry, no more cervical screenings and no more mammograms. So we don't have to worry about paying for your birth control for too long. It's terrific. What most people don't know this. I'm going to have an article on the website along with your show. Do you know the very first thing that Adolf Hitler, who, by the way, folks, and if you listen to my previous shows in the archives, you'll know this. He was not a right-wing fascist, all right? Everybody thinks he was right-wing. Adolf Hitler was a socialist. The Nazi Party is the National Democratic Socialist Party. And you know the very first thing he implemented after he became chancellor was universal health care in pre-World War II Germany. The second thing that he did of major initiative was a registry of all firearms. And the third thing he did was to confiscate all firearms. The rest you know. But it's kind of an interesting parallel. And it goes right back to Bismarck, who, by the way, was also German, his saying that you just quoted. So, I mean, since time immemorial, the power over life and death, the power over, shall we say, pain or no pain, has been a very useful political tool, and I happen to agree with you absolutely 100%, Grace Marie. So, we've talked about all this stuff and what's wrong with Obamacare, and I think people probably at least have a feel for what this law is about over the last 3 weeks. I want to turn our attention to the fact that there are obviously, assuming Obamacare didn't exist, there's obviously some things we'd like to polish and fix in the American healthcare system, which still is the best in the world. And in my mind, those things are, how do we get costs down? How do we expand coverage to more people? And how do we continue to, shall we say, number one, incentivize new doctors and medical professionals and new advances in medical technology? I mean, there are other things, but I mean, if we could accomplish those three things, I think instead of having a home run, we'd have a grand slam. Did I leave something out there?
Well, and I think the American people want to make sure that we do continue to have the quality of health care that they've come to expect, and that quality is something that's an ever-moving target, and it's evolving. And one of the things that happens when the federal government is in charge, they write all these rules and regulations, 20,000 pages so far, and it basically stops innovation because everybody has to conform with all these new rules and regulations, and they can't deviate and figure out, well, there's a better way to do this. Well, I'm sorry, the rules don't allow that. So it really halts development and evolution of medical progress. And in fact, I've talked with a number of people from European countries in particular who say, please don't do to your healthcare system what we've done to ours, because we are stifling innovation. In order to continue to have lower costs, access to more quality healthcare, access for more people to care, you have to continue to allow the market to innovate, to figure out how to do things faster, better, cheaper. When the government's in charge, it just stops that or brings it to a creeping pace.
Well, listen, if we had a menu, you and I, and we could select a bunch of things that we could do to improve the healthcare system, I think we'd agree, number one, on lower costs, right?
Well, yes, but then the next question is how do you do that? But yes, that's certainly the goal, because that's going to get us to many of the other things we want to do.
And we're going to, and we'll get to how we do that. The next thing would be higher quality care. The next thing would be more people covered.
Right.
The next thing would be some of these other little goodies that they've used to cloak the real sinister intent of this law, such as pre-existing conditions, kids can stay in your policies of 26, yada yada.
But those are all a part of the access category. So
yeah,
cost, quality, access. That's pretty much covers it.
Okay, so what would you suggest? I mean, concrete steps. The Republicans. I got to tell you, I'm not a Republican. I'm a registered conservative. Obviously, I would gravitate more toward Republican points of view generally than I would Democratic points of view, and sometimes Libertarian. Putting all that aside, putting politics aside, what can we do as a country to achieve those goals, get rid of this law, in other words, repeal and replace? The Republicans are great at screaming about this law. They are really lousy at coming up with a replacement deal.
Well, but I'm challenging you on that, Reid, because the fact that the mainstream media isn't covering what Republicans are offering as a solution, what does that tell you? Doesn't mean that they don't have ideas. They're just not getting through to the mainstream media because all of the space, all of the air is being taken up by Obamacare. The House Republicans have proposed any number of replacement plans.
Well, tell us about them.
Representative Tom Price has a plan already in place. I'm going to a meeting tomorrow morning to hear about a new plan that Congressman and Dr. Phil Rowe is offering. Senator Tom Coburn, Senator Burr, a number of senators, Senator Hatch, have all offered replacement plans. We don't have any ideas for a 2,800-page bill to take over the healthcare system by the government. It's strategic. It's looking at individual programs. What do we need to do to make Medicare work better, to make sure it's not headed for bankruptcy? How do we improve Medicaid so people can actually have access to a physician if they're on the program for lower-income Americans? How do we give people portability of health insurance? Allow them to purchase health insurance across state lines so you have more competition. Medical malpractice reform. All of these are pieces of getting the market to work better so that doctors and patients are in charge of decisions, not big healthcare companies, and especially the federal government. So there are policies and plans out there. Basically, there's just been a firewall saying, we don't want to hear about them, we don't want to talk about them, therefore they don't exist. Makes me crazy to hear that.
Okay, so let's go one step further. Do all of the plans, prices, co-burns, etc., do they include full-fledged competition insurance across state lines?
Some of them do, some of them don't. No, the Medicare, the Burr plan and the Coburn plan focuses on Medicare. So they're going to take that on and say, Dr. Coburn is a physician, still practices when he goes home to Oklahoma. So he understands this program. And the doctors are actually the ones who the members are looking to help with these reforms. All of them don't contain everything, and Speaker Boehner has said that he's going to bring up a series of bills so that we can do a strategic, step-by-step approach to common sense reform. And once you start to get the market working better, you start to then have people making decisions about what kind of coverage works for them. And yes, there need to be subsidies to help people with lower incomes to purchase coverage. But that doesn't mean they have to be in a program that is so constrained by government rules and regulations that they really don't wind up with any choices. And yes, we want to be able to have people purchase health coverage across state lines so that we can have a larger, more vibrant market for health insurance. But every bill doesn't need to include that. The goal is to figure out how do you get the cost of health insurance down by people making more sensible choices in a marketplace that is responding to them and not government regulations. That's how we put your doctor in charge of your health choices, not Kathleen Sebelius and her iPad. Well,
I happen to agree with all of that, but we're talking atmospheric levels. In my world as a rancher, things are very simple. Okay, water runs downhill. Period. It doesn't run uphill. It doesn't run across contours. It only runs downhill. And in my world, 2 + 2 = 4. And I don't see, and the feedback would be welcome here, but I don't see why the Republicans cannot come up with a cohesive, I'm not talking about fragmented little pieces here and there from this guy or that.
But you don't want that. If you do that, Reid, then you're going to wind up with the same problems that you've got with Obamacare. We don't want the government to re-engineer our health sector.
No.
We don't want that.
This would be un-engineering. For instance, in a 200-page law that, number one, allowed mandated full-fledged competition across state lines, number one. Number two, set up a fraud advisory panel. Forget the IPAB. The fraud advisory panel is elected by Congress, not appointed by bureaucrats. And it consists of doctors and consists of forensic accountants and consists of attorneys versed in Medicare and Medicaid fraud. Coburn himself has estimated close to $200 billion over an 18-month period in Medicare and Medicaid fraud. So, number one, the estimates of insurance across state lines are savings of about $40 billion a year, give or take. I mean, who knows until you do it, in premiums. Number two, the fraud board, who would seek out Medicare and Medicaid fraud, throw people in jail, and end it once and for all, rather than all this hyperbole that goes on in Washington about ending waste and fraud, would save about $200 billion, give or take, over an annual period. You then turn around, and you put in medical malpractice. You reverse the nonsense that the American Bar Association has managed to infiltrate into all sorts of bills and into the medical profession. In the test cases, and I'm sure you know this, Mississippi and Texas, they've lowered medical malpractice insurance rates by close to 2/3. And those medical malpractice insurance rates, when they come down, obviously the amount of money doctors make goes up, and the amount that they have to charge for services also lessens, lessening healthcare costs. And those savings are estimated at $50 to $80 billion a year. Then we come to the scummy deal with pharmaceuticals that Barry cut with them but didn't tell anybody about, which was, hey, no generic drugs as long as you guys support my bill, and that's costing us $80 billion a year in absolutely wasted, I mean totally wasted drug costs, mostly to seniors. If you take those four things together, you're at about $400 billion in savings. That goes into a pot, and the pot takes care of some of the goodies, pre-existing conditions in the special risk pool. You want to keep your kid on your insurance till they're 26? Fine. Covering the uninsured, the 30 million, 35 million, whatever it's going to cover. So, in my world, 200 pages with those 10 fixes, which is, they're not fixes. They're really undoing the government crap of many years and letting the market function more economically, number one, and more efficiently, because you and I agree on that. Why can't the Republicans come up with one short, concise bill? Here's your 10 bullet points. Here's what it saves. Here's how the money will be used, and it's really government backing out of health care. Why can't they do that?
Well, what difference does it make if it's in one bill or if it's in 3 or 4 bills? ObamaCare is actually 3 bills. It's not one bill.
But people, look,
you got to just show people the vision, and the vision's even more important, Reid. People need to understand, what is it you're trying to do? What we're trying to do is put doctors and patients back in charge of decisions. And there's one central unifying theme that gets us there, and that's a defined contribution for health insurance. Whether or not you're getting your health insurance through your employer, whether you're getting it through Medicare, whether you're getting it through Medicaid or any other program, we want you to be able to control those resources. Yes, we want to have a more vibrant market so that you have purchase of health insurance across state lines. Yes, we want to make sure that if people purchase health insurance that have pre-existing conditions, that they can buy health insurance and be able to keep that insurance, especially if they get cancer. Yes, we want to make sure that that seniors on Medicare can have access to physicians, and we're not going to bankrupt this program through ObamaCare. Yes, we want to make sure that costs of health insurance are not driven in medical care, are not so driven up by medical malpractice insurance that costs so much. All of that needs to happen. But if people don't understand our vision, then they're just going to see it as more government programs. They need to understand that what we're saying is you shouldn't have to have your health insurance tied to your job. If you want to move to a different job, if you want to start your own business, you should be able to take your health insurance with you, and you should be able to take that tax break with you, and prices should be visible, and you should have more choices. If you put it in one bill, I promise you, and try to get this through Congress, it's going to be another gargantuan, gigantic, big mess. If you do it with a strategic strike where you're just saying, okay, now we're going to focus on Medicare. That's a big enough problem all by itself. Now we're going to focus on the tax treatment of health insurance. We're going to do these in a sequential, reasonable way so that we can make sure this doesn't become another gigantic, obnoxious federal Christmas tree. That's what happens. That's why they're scared of a big bill. I'm scared of it too.
You and I agree 110% on the desired results. We agree 125% on the sinister intent of Obamacare and its dark, dark, dark endings if it is enacted, both for individuals, Constitution, the economy, you name it. But I will tell you that, once again, I'm going to go back to my world, okay? People don't get all this stuff. They just don't get it.
That's right. That's why you give them more programs. They're just going to tune out. They don't want to hear it. They want to hear, what are you going to do for me? How are you going to fix this for me?
Exactly. That's exactly what they want to hear, Grace Marie. And it's talking about all this other stuff, they don't get. What they need is 10 bullet points. We're going to do these 10 things, and it's going to have these 10 effects on your health and your wallet and your family. I mean, let me tell you, my publishers, I love, writing flowing prose, and my readers love it and all that stuff. And when my publishers do a promo on my books, I learned something a few years back. I mean, I knew it, but I knew it innately, but it was hammered home. One of my editors, who's in charge of promotions back there, she has a saying: a 2-year-old with a crayon has to understand it. And she is exactly right. And that's not an affront to the audience or the American public. Everybody has so many things going on, and I'm talking to you about this because you have the ears of some of these people. The reason that people haven't heard about this is because it's fragmented. The reason that it's getting drowned out by Obamacare is because Obamacare is immense and confusing, and people lose themselves in the confusion of Obamacare. They have no more mental energy to follow through on the replacement for Obamacare. What really, I'm telling you, what needs to be done is you need a bill, and it needs to handle all these things, and it can do it in 200 pages.
You've got Tom Price's bill. You're going to have Phil Rowe's bill. You're going to have 3 or 4 more within the next month. I promise you. You're going to have them. And what I hope is that the mainstream media is going to cover this so that people will be able to not just pick out one little thing that looks like, oh, that's going to scare us all to death, but to look at it in totality. Good luck with that. We'll see if they do. That's why I think it's so important for people to understand, what are we trying to accomplish with this? We're trying to get the market working so that prices will come down, so that the amazing possibility for bringing technology to bear in extending access to health coverage and making it more efficient and making it more cost effective. Those are the kinds of things we're trying to achieve and accomplish. And if you get tangled up in all the nuances and the nightmare of legislative language and all those details and what is the CBO for this is being, you lose it.
You don't need to do that. You don't need to do that.
You will if you get, it's not a 200-page bill, by the way, that you're describing. That's a 1,200-page bill.
No,
for starters.
No,
yes,
it's not.
It is.
Yeah, I could personally draft that bill in 50 pages.
Good. Then let's have you do it.
Fluff. I'm sorry?
Let's have you do it. Do it then.
I would be happy to. But, I'm not going to do it I'm not doing it for my exercise.
In order to untangle federal programs, that's a very difficult thing to do. And if you don't get it right, you wind up with more problems than you started with.
Untangling federal programs is where this replacement's going to bog down. You need to forget about the federal programs that are out there right now.
Medicare's out there. Are you going to get rid of it?
Hold on.
What are you going to do with Medicare?
Hold on one sec. You need to get out the key ingredients to begin to revamp the system, i.e., backing government out of it with the 2-year-old with a crayon. Here's the 10 things in this bill, and here's the 10 things it will do for your health, your wallet, and your family. You need to be able to give people one page with the 10 bullet points and the 10 benefits, and then they'll get it. And then, once that is done, and you have things done at the stratosphere, the lawyers are out of it, insurance companies have to go across state lines, yada, yada. I'm just picking 2 of them, okay? Once that's done, then you have a framework to go back in and start taking Medicare and tinkering with it, and Medicaid and tinkering with it. But people are going to get lost in these details. One of the reasons Obama... Besides
I've got the 10 points of things we should do in the book already.
Okay. And do any one of these bills have all 10 of those in there?
It doesn't matter, Reid. It doesn't matter. It just matters that they get through and the American people understand it. The processes of how things go through legislatively is a whole other game of what are we trying to accomplish and helping people understand it doesn't work for the federal government to control our healthcare system. They control our lives and our freedom if they do that. What we've got is a plan to put you in charge. That's it.
Would you agree that one of the reasons, besides the fact it's a horrible bill and people are starting to get a glimmer of how bad it is, but one of the things which stopped Obamacare in its tracks is its complexity? Would you agree with that?
It has not stopped it in its tracks. They are continuing to implement this thing by rewriting it, and the president just keeps making it up.
I'm not talking about the lying scumbag elites in Washington. I'm talking about in the minds of the public eye. When you have 67% of the population growing by 3 or 4% a month that want it gone, I would say that public opinion is stopped in its tracks. And in the end, it's public opinion that you need to get rid of that and get something else in. My point is that part of that public opinion, I mean, people are learning more about it now and they're beginning to dislike it because of facts. But in the beginning, they weren't warmed up to it because they didn't get it. Because it's very complicated. I mean, I've been following it like you have since 2009 and not as much as you have. And you know what? I don't get it all.
Nobody can understand this. No one person could understand it.
And so when you have fragmented pieces, I mean, we're really talking about the psychological battle right now, okay? The psychological battle for the hearts and minds of the American public, which in the end is what's going to either kill Obamacare or let it live, or get a replacement in there or not. It has to be so simple that they get it, that it can be summed up literally on one piece of paper. You couldn't sum up Obamacare on one piece of paper.
Nobody could. Why should I do that? I've got the 10 top reasons that you should not like this law.
But my point is, if you have 5 different bills that are each handling this and that and Medicare and whatever they're handling, what you're doing is you're creating in the public's eye kind of the same confusion that they created with the 2,700 pages of drivel they call Obamacare. You're not intending to do that. You don't want to do that. But I'm telling you, the average American...
We're arguing process here, and
yes,
I don't think that's helpful. I think we need to talk about the policy. What are we trying to accomplish? How it's done is really secondary. What we're doing is what really matters, and we're losing sight of that here.
You know, what you're doing is great. If you can't get it passed because the public's not behind you, it doesn't mean anything.
Which means you've got to explain to them, what are you trying to do? What's your vision? How is this going to be different than having the federal government control our lives and take away our freedom and our ability to direct how we want to spend our own resources?
People are tired of listening to politicians and their visions because they don't believe them anymore.
Well, then how do we deal with it? If you can't explain the vision and you're going to get a law, I promise you.
You need to have a comprehensive bill that fits in 200 pages or less. That can be
fine. I'm sure I'll see
1 page.
How many pages Phil Rose his bill is on and consumes and Tom Price's. You can get anything down to 1 page, but what you want to do is help the American people understand what you're trying to do and why Obamacare is so bad. Our book, Why Obamacare is Wrong for America, the top 10 things wrong with Obamacare. Go to our website. We've got pocket cards. We've got all sorts of ways for people to understand, quick flashes, all the reasons that this is bad for women, it's bad for families, it's bad for taxpayers, it's bad for business, it's bad for employers.
We agree so completely it's ridiculous. And the reason that you're getting across to the American public is why? Because you have the 10 things that are wrong with Obamacare, right? You took 2,700
Not the only 10 things, but it's the top 10 things in my book.
Listen, there's thousands of things. There's things that you and I don't even know yet that are wrong with Obamacare. But
they're still making
all
up.
the things that are wrong with Obamacare, you were able to condense it down to 10 really ugly facts. And people get it. The replacement, you have to be able to do the same.
I can do it in 10
That's
points.
really the point I'm making.
I can do this. You've done it already. Make the tax treatment fair so people can have portable health insurance. Deal with the issue of the medical malpractice insurance, purchasing health insurance across state lines, reforming Medicare, reforming Medicaid. We can do that. We've got our 10 bullet points.
You see where you lose people? Where you lose people is when you say reform Medicare. They're going to go, oh.
It's going bankrupt. We got to fix it.
I agree. But it has to be put in a different context. It has to
modernize Medicare. Improve Medicare. Save Medicare.
More money for you from Medicare. People get that. More money for you from Medicare. I mean, it's really that simple, right?
not. It's if we have more money in Medicare, it's just
more
going to
money
go bankrupt faster.
More money for you in Medicare.
But this doesn't work, Reid. It doesn't work. We've got to make Medicare more efficient. We've got to spend the money that we have smarter so we can save money over the long time. Look at Medicare Part D, the prescription drug benefit. They said it was going to cost much more than it's costing, and the reason that program is saving money, coming in at like 40% under what the original expectations were, is because you've got private competition, people making their own choices, seeking value in the marketplace. We can spend less on Medicare and people can get more.
You're 100% correct, and you're 100% right. In addition, the point is you have to get that across to people. Otherwise, you're not going to have the public support to get any of these.
I'll do that in my one bullet point.
There you go. So, I think to sum up, you and I agree, it sounds like, on about all the 10 points.
We do. We agree absolutely where we want to go.
At the stratospheric level, okay? And you and I agree on the at least 10, try thousands of points, which are ugly, dark, sinister, and anti-American about Obamacare. And by the way, folks, anti-your health. This is not about your health. Forget it. It's not about that. It's about your soul. Understand that. And your wallet. It's about your soul and your wallet. But where we disagree is in how to present it to the American people so that they totally, once and for all, abandon this beast, Obamacare, and get on board with the replacement. And the replacement, I think we both agree, is the dismantling of government fingers in the health pie, not the creation of more fingers.
I agree.
Are we agreed?
Absolutely. Getting government out of the health sector and getting the marketplace to work and giving people choices and getting costs down. That's what we want to do. Exactly.
All right. Well, listen, folks, I'm going to once again give you Grace Marie's book, and you should read the 10 things wrong with Obamacare and the 10 ways to fix the health care system after we get rid of the beast. Why Obamacare is Wrong for America. It's published by HarperCollins. Barnes & Noble, Amazon, you name it, and then go to Galen.org. You can learn more about Grace Marie. You can learn about the great work that she's doing to try and fix your health and save your freedoms. And be looking on our site and her site for her Obamacare. It's Obamacare.org or ObamacareWatch.org.
ObamacareWatch.org.
ObamacareWatch.org. That's going to be up and running in the next month. We'll have links on our OnTheRightSideRadio.com site, and of course you'll be able to go right to her site by dialing it in. And listen, Grace Marie, it's been, I can't believe an hour's gone by already, but it has.
We have had a very good, lively discussion among people who agree, Reid.
Absolutely, and you know what? And that's good stuff.
Between people agree. That's right.
This
is the way we make things happen. This is the way change happens.
Absolutely. And listen, I want to thank you very much for being on. Folks, I hope that we ended on a positive note. Not all is dark and lost. Together we can put our shoulders to the common wheel of freedom and good health. We can get rid of this beast which is being forced upon us for reasons entirely separate from health. That's just the cloak. And we can replace it with something that begins to restore the American system to health care, which in the end will mean more people covered at less cost with better access. It's as simple as that. Grace Marie, absolute pleasure. I'm going to have you back on. We're going to talk about these replacement bills. When is the first going to be introduced?
Dr. Price's bill has already been introduced, and I will find out tomorrow when Dr. Rowe's bill will be introduced, and there will be several more to come. So, look over the next month. I think you're going to see a lot of activity on the replacement front.
Maybe we will plan to reconvene in October, and let's talk about those
that's a great idea.
And acquaint people with them.
Great.
All right, terrific.
Okay.
Folks, this is Reid Lance Rosenthal on the right side with Grace Marie Turner. It's been a terrific interview. It wraps up our 4-part Obamacare series. Along the Rockies from Nebraska to Utah and Montana to New Mexico. Everybody have a great Saturday and a great weekend.
For more information about Reid and his work, please go to ontherightsideradio.com. There you can also click to purchase the first 2 volumes of his #1 best-selling historical Western series, Threads West, An American Saga, and Maps of Fate. And now the first volume of his new nonfiction series, Land for Love and Money, is available everywhere, or go to landforloveandmoney.com. That's Land for Love and Money. We'd also like to remind you that if you've missed any shows, you can go to the show archives on Reid's ontherightsideradio.com webpage. We look forward to seeing you again next week for another episode of Reid Lance Rosenthal, On the Right Side.